It's been less than a week since the coronavirus reached Gaza, but already it's clear that the territory is woefully under-equipped to cope with the pandemic. Authorities are doing what they can.
Gaza municipality is organising the cleaning and sterilising of the markets in an attempt to prevent the spread of the coronavirus. We're doing this despite being short of facilities and equipment. It is our duty to try to prevent the virus from spreading.
The UN has already warned that the crumbling infrastructure will not be up to the challenge. Basic healthcare and sanitation, it says, are simply inadequate. Members of the Palestinian Islamic Jihad's armed wing, the Al-Quds Brigade, taking to the streets. Not to demonstrate or bully, but to join the effort to stop the virus from spreading. Business, too, is contributing its expertise. This Gaza factory is producing protective clothing for medical workers to its own design.
We want to protect ourselves and medical staff. Production has reached around 1,000 suits so far. There are 6 factories working for us.
Mosques in the Palestinian territory have closed, while mass rallies planned for next week along the border with Israel have been cancelled. People in Gaza are doing what they can to prepare for the pandemic, but their poor amenities and infrastructure mean it's likely to hit them hard.
Joining me now from Gaza is Matthias Schmaler. He's the director of the United Nations Relief and Works Agency for Palestinian refugees in Gaza. It's great to have you with us, Matthias. So far, there are at least 9 confirmed infections in the Gaza Strip. How would you describe the situation there right now?
Good afternoon to you. I would describe the situation as one of a mixture of panic, since the first 2 cases were announced a couple of days ago, and very deep worry about what would happen if there is an indigenous infection and a serious outbreak. As was evidenced in your report just now, the hospital sector here is woefully unprepared in many ways. What I've been told is for every 100 patients who would get ill, you would need at least 5 intensive care unit beds. Now, there are 60 maximum in the whole of the Gaza Strip, so you can do the math. Wow. As soon as there are more than 1,500 people also ill, the hospitals would simply not cope. So that's one big concern. The other concern is that in these crowded conditions, with 8, 12 people often sharing a 2-bedroom apartment, let's say, it's extremely challenging to implement the usual measures being advised by the World Health Organization, like social distancing and, of course, proper hygienic conditions in terms of hand washing and so on is also a challenge at the best of times.
Matthias, Gaza has been blockaded for years by Israel and Egypt, of course. How might those countries respond? For example, is there any talk of temporarily lifting restrictions for humanitarian reasons?
Well, there's a couple of things to say about this. So, number one, there has been over these last 2-3 weeks since Corona reached the region, let's say, a relatively pragmatic cooperation with the Israeli authorities. So the goods we have needed to bring in for hospitals and so on as United Nations, they've allowed through. They've also not curtailed the movement of other goods. We run, for example, as UNRWA, a food operation for over 1 million people. So more than 50% of Gaza's population depend on food. And of course, in a lockdown, it's critical that people have access to food. So far, that has not been blocked. What has been blocked is movement of people, and that's understandable. Our worry is, and our appeal to Israel, but also Egypt as another neighboring country and the international community is not to forget Gaza. It is understandable that with this being a pandemic and all countries, including Israel and Egypt, being affected, that the focus is at home, trying to keep one's own population safe and healthy. But an outbreak in Gaza will also affect Israel and and Egypt. And the last thing we would want is a complete shutting of the borders. People need food and need other materials for the hospital sector and so forth.
Matthias, we have less than 30 seconds, but I want to ask you this. We know that the key to slowing the outbreak is social distancing. Is that even realistically possible there?
It is really challenging, but we should never give up. We've learned from the Ebola crisis that also happened in impoverished, overcrowded areas that social behavior change is possible, and we are doing what we can to effect that.
Really appreciate your being with us. Matthias Schmaler, Director of the UN's Relief and Works Agency for Palestinian Refugees in Gaza. Thank you so much.
Thank you.